She said, my husband died not too long ago. I have two children. We depended on his income. I was a stay-at-home mom, former nurse. We had two lease cars. We have a mortgage. I have two small children. We didn't have any life insurance. And I've fallen below the poverty line.
Ladies and gentlemen, welcome back to another fabulous episode of the Healthcare Trailblazers podcast. Very happy to be sitting here today with Gil Bashe. Gil is, you don't even see, some people, they're really only important because of what they do. I think Gil is one of these people that you see around, you see his content. You don't even have to know what he does specifically to know this guy's got something. This guy's got a voice. This guy's got power. And so I've been seeing Gil all over LinkedIn, started connecting with him. It's an absolute pleasure to be sitting with you, Gil. I appreciate you coming on today.
Mutual. It's so mutual.
Gil is the editor-in-chief of Medica Life, which sees about 1 million readers per month, and also the chair of global health and purpose for Finn Partners, and specifically purpose, because Finn Partners is one of the only companies in the communication space that really revolves around purpose, and really all their initiatives tend to really drive around that. And so it's super interesting. These are some of the fantastic things that Gil is doing. Once again, Gil, thank you for spending time with us today.
I'm so appreciative to be with you. You know, when you reached out, we had our first conversation. I have incredible admiration and respect for people who have big ideas, knowledge, as you clearly demonstrate, but also are rolling up their sleeves to make things happen. It's not theoretical for you. And I think a lot of the people who I see behind the main stage, you know, as I get the privilege to sort of walk up the little steps and wave hi to everybody, you know, they are authoring books, they are executives, but you're very unique as a leader of our industry. You're actually building business, and you're looking at the gaps that exist in terms of the aspects of fragmented care, and you're trying to fill that in. You're an unusual person. So I guess it's unusual guy meets unusual guy for 45 minutes of conversation. How cool is that?
Well, I appreciate that tremendously. I really do. It's coming from you. That's really the highest of praise. So thank you so much. Well, kind of getting into it, let's do a quick start of kind of where you came from. Why did you choose communications, and was it always about healthcare, or did you kind of lead into that?
Well, that's a really that's a heavy question, my friends. A very heavy question. So if you had said way back when, you know, Gil was like young and I had some tufts here, I wasn't able to connect the mustache to the beard once upon a time. Would you said like Gil's going to be in the sciences and environmental issues? Probably not. Probably not. But life offers us many different opportunities. Too often, as we're walking down the street, we're looking at our cell phone instead of life. We're looking down instead of up. And I was blessed to look around, not just up, but around. So just a little bit of a snapshot of how I got into this business. It clearly is part of a grand design, I believe. And I'm very privileged to be working in this and meeting people like yourself. So I did study environmental affairs in my graduate work, but it was during my Army service. I served 6 years in the Israeli Army as a paratrooper, and during that time, I also spent 6 months in a major hospital in Jerusalem, Hadassah Hospital in rehab. I won't go into as a patient. I won't go into the gory details. But when I got out, I decided I wanted to return to my unit. I had an option not to. I wanted to return to my unit. They were very surprised. I actually kind of requested / demanded that I go to the combat medics class. I felt I would do better on myself than the other guy did, you know, next time around when they're dumping me on a stretcher. So I graduated as the outstanding combat medic from my class. I rejoined a great paratrooper unit commanded by the former leader of the Israeli Army Commando Paratroopers. It's called Sayed Sanchanim. He was now head of a battalion. I joined him as one of his combat medics, one of his operational medics. And it was really, the future came clear to me in war, sadly. War is a terrible thing. I'm not a pro-war person, heaven forbid. I'm a peace person. Sometimes that's an option, unfortunately. But it was rescuing wounded enemy soldiers under fire. We have a code of conduct called the purity of arms. And it basically requires us to be responsible for all life. When someone's put down their weapon or someone is injured, they're no longer a combatant, they're a wounded or they're an injured vessel.
Wow.
And rescuing people under fire and dragging them back in and having to care for serious wounded. I don't speak Arabic, but something about my demeanor, how I was approaching them, made them realize I wasn't going to hurt them. On the contrary, I was desperately trying to help them, and I did evacuate them along with our wounded in triage and war. Um, I knew at that point I was hooked in health, and I was considering different paths to express that. One was maybe I would become an occupational therapist. One was maybe I would become a physician. And I chose another path, to the dismay of then dismay of my physician father-in-law, who thought certainly I should be a physician. I said, Bert, may he rest in peace, who was a great physician. I said, Bert, I'm going to go into health policy. And I said, you help many people one at a time. I'm hoping to help millions. That's how I got from policy into communication. It's a passion and understanding that communication is part of the care. It's part of the cure. And that, people who are ill or seeking healing, at that moment, they're listening intensely to what the health professional says to them. And that communication can direct them toward despair or hope, like hype or hopelessness. And I just felt that authentic communication that was based in accurate information would help people make informed decisions. And through that experience, my own, having been in a hospital for quite some time, and then unfortunately having to help very seriously injured people, it made me realize that this was my calling. And I've been doing it with passion ever since. And it doesn't mean that I'm dealing with trauma in terms of health communications or policy. Sometimes I'm dealing with children who are ill. I'm dealing with seniors who are ill. I'm dealing with people who are suddenly diagnosed with cancer, neurological illness, who I'm dealing with hospital leaders who are looking to transform their system. Sadly, this is a never-ending calling. That illness has existed as long as humans have walked erect on this planet. We've had illness. I can't overcome illness, but I can actually build bridges in this fragmented health ecosystem that we have. So that's kind of the genesis of this unusual journey.
Wow. And it's so interesting to hear you say that, because as you're saying that, I'm listening, and I think you're obviously not only correct, but it's interesting to see that you've kind of got these levels where, like you said, your father-in-law was a doctor and he was caring for patients one at a time. You wanted to go from there into policy to be able to affect millions of patients, not just one individual at a time. And I think from where I sit, talking to people in the government, policy people, and then people that are actually, executives and implementing healthcare and healthcare reform. What's super interesting to me about what you said is that I think that your move into communications was the next step, because what's so interesting is that policy at the end of the day is not only ineffective, but often misguided without the communication that brings between the policy makers and the people on the ground. And then obviously the third step of that is patience. So I think, it's like kind of like the next step above policy is actually making policy effective, is the work of that you're doing.
Yeah, and look at the work that you're doing when we talked about it. I hope you'll just share a few words about this with our listeners and viewers right
Sure.
now, because I was just so impressed with your depth of the nuance of our health system. Normally I'm speaking to people and they don't appreciate how fragmented our health system is. You've got people in we know we're going to have an aged population. You've got people struggling to deal with what happens when I don't have someone to take care of myself. Where do I go? How will I get the care I need? Who will pay for that care? You're looking at artificial intelligence or augmented intelligence. You're looking at all these different technologies and you're applying it to the system. I think it's magnificent. You're not living in the theoretical world. You're living really in the operational world. So, I think you could appreciate that more than other people.
Yeah, no, I appreciate that very much. I do consider myself lucky to a certain regard that I am obviously definitely not a physician. I didn't go to medical school. Um, and, I think my lack of education or formal education, um, coupled with trying to just be aware of just the reality the way I see it, and understanding that I don't have that lens. I just have a regular person lens and try to look at things with common sense. Um, has really blessed me with the ability to realize some of those things. And what I do every day is as the CEO of Proviva Health Group, which is a care coordination company. And so I'm 1 degree removed from patient care. But we have team meetings every day and every week, all hands on deck, and talking to all of our care coordinators and hearing the success stories, hearing the challenges the patients are going through, watching the challenges that our care coordinators have with actually providing the care, communication issues between them and the doctor. And so there's so many of these pieces that I'm able to just kind of see from that outsider perspective. And you're absolutely correct. I mean, there's a ton of nuance that's necessary, because it kind of sometimes it seems super overwhelming to me, the system. But sometimes when you focus in, it's like, okay, I feel like I could really make this system work with 10 patients. But then you zoom out to 100 patients, 1,000 patients, 1,000,000 patients, 10 million patients, 80 million patients that are on Medicaid, or 90 million patients, I think, that are on Medicaid. That's not even including Medicare. And it starts becoming very convoluted. So it's always like kind of this back and forth,
Think of what you've just said, because it's so critical that you talked about Medicaid. These are the people generally who are most in need of access to care.
Yep.
If we look at this, these are the people who live in often neighborhoods where the air quality isn't great. In many cases, they're living in, strangely enough, even in urban areas, food deserts. They don't have access to healthy foods. They don't have access to great health care. The medical system in their neighborhood that they go to is not an academic medical system at the state of the art. They need that coordinated care. They need that visit. They need that contact.
Yeah.
And if we look at the expense of our nation, it's the withholding of proactive care from that population that contributes to the fact that 20% of this nation's GDP is dedicated to health. It's not just about the waste or the administration. It's not just about the pricing of medicine as we know it. It's actually the withholding of medicine that actually is rising up, is raising our cost structure again and again and again. And if we look at the emergency rooms, where do these people often have to go in order to get their care, even though they have Medicaid? It's the ER, and that's costly care. So you're really in the front lines of trying to put patches on a system that, quite honestly, I'm not really sure how we can repair our fragmented health ecosystem. But I think you're part of the fix is to shift the system to the people who need care the most and need that personal care the most. And that's where communication comes in. It's the people you choose to work on your staff. They're not just skilled health professionals who care.
Yep.
They've got to communicate why take your diabetes no treatment, why take your asthma treatment. And I'm positive, you'll have to verify this. You know your population a hell of a lot better than I do. Look, the majority of deaths around the world still are from non-communicable diseases that are manageable. Obesity, diabetes, cancers, respiratory illness, mental illness, and so forth. And unfortunately, that's consuming for you and your team.
Yeah. You're absolutely correct. And I know we're kind of going off on a tangent here a little bit, but it's like you said, it's a conversation. So, I was just started this book by Zeev Neuwirth. I don't know if you've seen him around LinkedIn, but he's a doctor, and he's actually going to come on the podcast in a little bit. And he's put out a book already, but he's coming out with a new book in the beginning of September. It's called Breaking the Walls, I believe.
Okay.
And he discusses, he says this one story there where he's quoting a different doctor, and this is a story that changed this doctor's mind. How he was sitting with a patient. It was an elderly African American patient, and everything was wrong with the patient, high everything. And the doctor just launched into this, tirade speech at the patient. Do you understand the dangers of high cholesterol? Do you understand the dangers of this and that and the other, and obesity? And here's what you got to do. You got to start eating cleaner. You got to start exercising. You got to start this. You got to start that. Go to the gym twice a week. Go shop for. And the patient kind of sat there calmly and listened, and then stopped, and then said, "Do you know where I live? Do you know anything about me besides that?" And I mean, it's such a common thing. And the patient just explained, like, there's no gym around me. There's literally a bodega store, and I have to go really quickly there and back so I don't get hit by the gangs because they see I'm going shopping. They think I have cash on me. And so there's so many issues they didn't even ask. And what's so interesting to me is because a big part of my job as CEO is just business operations and business development. So a lot of it is sales. And I've learned this, like, stop and ask the questions. You will be so much better off. In sales, it's the same thing. Like, don't get on the call and just communicate at somebody. Communicate with somebody,
The social determinants of health are where the rubber meets the road. You clearly know that. I mean, you've just expressed that spot on. And the realities we face, if we're going to deal with core health issues, we have to start to appreciate the fact that the physician comes from one background generally. And rarely do I find that when people go to hospitals, do they see, and they're on Medicaid or Medicare different, but Medicaid specifically, rarely do they see people just like them. And that's also part of the issue that we're facing in our health system right now. But to your point, it's hard to talk about serving healthy foods when healthy foods, unfortunately, cost a lot more than going to McDonald's or any other fast food chain for the afternoon special, where you get, like, for $1, you get twice as much. So, what do you eat? You're hungry. You eat a hamburger. You eat French fries. You'll gulp it down with a big drink, big soda. No, sort of, and that's just contributing to the problems we have. And so we have to understand when we're not looking at the food stamp program, we're making it more arduous to access, or we're not looking at what it's like to be a young single mother who has fallen below the poverty line and not recognizing that we need to jump in and help here, then what have we become as a society? Just as a caveat, a story, many years ago, my then young daughter volunteered to work at a food pantry at her school, which meant I volunteered. And it was before Thanksgiving, and a woman pulls up in a brand new Jeep Cherokee, and I'm loading packages of food for the Thanksgiving holiday into the back of her Jeep Cherokee, brand new. And she's wearing sort of like a white, like health professional, like nursing attire. And I'm just being quiet and doing my volunteer thing. And she says, "You're probably wondering why I'm here." I mean, she's attired nicely and she's driving a very nice car. And I didn't say anything. That was coming from her heart, but I was wondering. That's the truth. She said, she was young. She said, "My husband died not too long ago. I have 2 children. We depended on his income. I was a stay-at-home mom, former nurse. We had 2 lease cars. We have a mortgage. I have 2 small children. We didn't have any life insurance. And I've fallen below the poverty line. They won't take the lease cars back. I've got to make the mortgage and sell the house and support my children." And you realize how fragile we are. We're talking about these theoretical issues, social determinants of health, the Medicaid reimbursement system, 20% of GDP goes to health expenditures. But normal people in this great nation can suddenly be living and going on one lane and suddenly switch over to another. We owe it to people in this country to think these things through. There's a tendency to think everybody who's on Medicaid, is a loafer. And trust me, that is not the case. People fall below the poverty line because of illness. They can't hold down a job. To get Medicaid, your income has to be below a certain level in order to get the free health insurance that Medicaid pretty much offers. We don't necessarily have a system that works. And you're involved through your work in the intricacies of that system. Again, I said earlier, Amanda, you're kind of where the rubber meets the road right now. And I think that anybody who's interested in improving our healthcare system should probably make a direct beeline to you to get your perspectives. You're trying to build a sustainable business. You've got staff that are health professionals. You're trying to help hospital systems keep people out of the hospital. Maybe they were inpatient. Now they're out. If they're back in within the 30 days under
TCM.
the DRG, they foot the bill. So the star ratings of CMS, all this seems to be good checks and balances, and yet it just perpetuates illness. I got to get them out because I'm not going to get reimbursed after a certain amount of time. I got them out, but I don't have a care plan in place, so they're going to bounce back.
Yep.
I've got to make sure they have the services. And by the way, when we send them home, does anybody check their refrigerators? Is there food in that refrigerator?
Yep.
Is the house clean? Is there someone to look in on them? I imagine you're responsible for all of that. Like, you're taking up that burden of society. First of all, thank you for that. Thank you, your colleagues, for that.
We're trying. We're trying.
But we have these conversations, and too often they focus on the special guest, and I'm honored to be your special guest. I know it's not your intent to turn it back on you, but I learn a lot from the people on the other side of the mic. I mean, you're really in the trenches of health.
I appreciate you, Gil. Yeah, I always say with the podcast, people tell me, which I take as positive feedback, that it doesn't seem very scripted. It doesn't seem very journalistic, like I'm sitting with a list of questions. And the truth is, because it isn't. And I think one of the most powerful things with conversations like these is actually just to be able to be present and look at you and listen with my ears and with my mind and actually hear what you're saying, and not just, so often in conversations we're just listening to each other, but we don't even hear the words that the other person is saying. We're just thinking, what am I going to respond, or what can I say next? Or our brain is like, and so something that I've come to really appreciate through doing these things is just to have a conversation. And so whichever way it goes is absolutely fantastic. I don't mind.
Yeah, I thought everybody who's listening in who will hear our conversation, I hope you don't mind. We appreciate people reaching out to us directly with their questions, adding to the conversation, asking for our help. The reality is we're trying to improve this together. These conversations that you set up are really in the spirit of not just sharing information, but inviting the whole ecosystem to unite with us and making a difference in improving health, making sure it's accessible for people.
Yeah, exactly. So speaking of interacting with those listeners and with those people, you've done plenty of keynotes and speeches in your day. As a purely selfish question, can you talk to me about your journey into becoming Gil, the keynote speaker, and what that's like to speak for so many people?
Yeah, I'm trying to figure that one out myself right now. Maybe it's because I hung around long enough, and they're frightened if they don't invite me, and I die, they'll feel bad. I don't know. No, hopefully not.
I doubt that's it. Something tells me.
So part of it was not just having ideas in my head, but my willingness to share those freely and openly with my colleagues. People used to say, well, "Why are you doing that? Your quote competitors will pick up on your ideas and use them." And by the way, those people who are in my space do that. I see them using language I've used or exact phrases I've used and so forth. And people say, "Doesn't that upset you?" And I say, on the contrary, it's a privilege. It's a privilege to see people take an idea, recognize that it's valuable, and apply it. And I'm not saying imitation is the finest form of flattery. It's more than that. It's much more than that. The reality is I'm trying to operationalize people and get them engaging in the system, improve people's care. And if they want to do that, then we're allies. We're allies in the mission. So, but to answer your specific question, it started a few ways. One, I did have kind of edgy ideas and that I wanted to pursue and wanted to share. I think the one of the edgiest I had, that two of the edges I had, which were kind of before their time. One was in the year 2000. I wrote a article in a magazine called Pharmaceutical Executive, called talking about the emotion of health marketing, and and I talked about sort of how we make decisions, synthesizing our head, heart, and gut. The intellect or the rational aspects, the heart, which is the emotive aspect, and gut, which is intuition. And I talked about how brands are created through that mechanism. And people said, Gil, it's really about product attributes. Short wait time, nice comfy seats, um, purple pill, blue pill, small. And, I said that people are really, see this from a more personal side. And so I started to share ideas that were differentiating from the marketplace. That was one. My biggest thing was I wrote an article through the result of a relationship I had with a group called Yankelovich. I don't know if it exists any longer. It was a big polling group. And they did for me a survey of about 12,000 Americans looking at 15 different chronic conditions with about 250,000 data points through 2-hour in-home interviews. And I came
2-hour
out.
interviews with each patient?
Yes.
Wow.
Yeah, I know it was a huge undertaking. And I wrote up the article and I came up with certain hypotheses based on the data.
Mm-hmm.
One, people who share an illness feel a common bond across the demographic aspect. So a short order cook in North Carolina and a member of government of the president's cabinet who both have colon cancer will feel a unique bond with each other put together. A woman with breast cancer, heaven forbid, but a woman with breast cancer in sort of like a south side of Boston will feel an affinity with someone who's like in Beacon Hill, because that's a common bond. That was one. And then this was the dawn of what was called then the World Wide Web, pre-web, pre-internet. It was called the World Wide Web. You had code numbers. And I said, these people are going online. Their situation is driving them to go online. Now this is get ready for this. This is 1995.
Wow.
Yeah, 1995. So, and I wrote, and I said, this is a huge opportunity for the pharmaceutical industry to engage patients and actually support this development of this World Wide Web and make it readily available. You had to pay for it then, like AOL and so forth. It was $9.99 a month. I said, and create free opportunity for people with serious illness to engage and connect with each other. And they said, Gil, you don't really understand who our business is. And I understood what their business is. I was in health, pretty deeply. They said, our business is doctors. We deal with doctors. We don't deal with patients. Now, obviously, we're dealing with the early rise of direct-to-consumer advertising. Patients were a pull-through mechanism for them.
Mm-hmm.
See your doctor. The patient was nothing more than a bridge between awareness of the condition and the buyer of the product, perceptually the doctor. And I wrote that. So I was willing to share edgy ideas that people were not accustomed to. It started there. And then I'm going to lift up first just a second, apologize.
No, you're good. Can we actually dig into that a little bit?
This book.
Look at that.
So I wrote this book in guess what? It published in 2000. It was the first book, was heralded as the very first book on health branding.
Huh.
And so now, of course, we see all sorts of people writing books on health this and health information, but you can't get this book any longer. It's out of print. I have some copies, but I published this book and I talked about issues of the fragmentation of medicine. I talked about how doctors are so specialized, they only see your disease condition through their lens. So someone's complaining about a GI symptom, they treat the GI symptom, they overlook the other symptoms because that's not their specialty. And so I wrote about these issues 24 years ago. And so I was out there talking about stuff before its time and publishing it and talking about it. And that put me on the path for people to say, this guy, I don't know if it's true or not, he sees kind of around corners a little bit. Let's have him as a keynote. Let's have him as an author. And I wasn't frightened of being pushed back at. I'll go further. I wasn't frightened of being ridiculed. I felt that it was important to express these points of view that were based in some objective data and put them out there, even though the system itself was created differently. So that was the genesis of that. And I kept on doing that. I kept on taking differentiating points of view, and kind of walking my walk around purpose, and staying true to that. And joining not-for-profit boards, and dedicating my time to helping people who have serious health conditions get the information and get the care they need. I've been privileged to be a regional chair of the American Heart Association. I'm right now on the American Diabetes Board. I'm on the Marfan Foundation Board. I'm advisor to Let's Win for Pancreatic Cancer. I'm on other corporate boards, and on the corporate boards I'm on, I donate all stock and compensation to charity. I don't accept any of it personally. I don't want my points of view to be colored by distinct economic gain. I want to help these enterprises succeed, and I want them to improve patient care. So I think that started it also, an authenticity and a willingness to share ideas.
And before I make my next observation, what was that physically like? Or what, I'm sure by now you're used to it, but or maybe you were always used to it. What was that like for you to be out there on stage talking to hundreds or thousands or however many?
Yeah, thousands sometimes. Sometimes, these days, of course, with the in real life and virtual component, you're gonna get thousands. So look, I'm a truthful person. When I'm standing behind the stage, with all mic'd up and waiting for the countdown to walk up those 4 little steps onto the main stage from behind the stage, 10 minutes before, I'm feeling some butterflies. 30 seconds before, I'm in the game. But when I put the first step on the main stage, I'm there for those people. It's really about the audience. It's really about the people they can impact. And I suddenly feel this surge of privilege that I'm there to serve all those people who are in the audience or listening in, and hopefully giving them a sense of spark that, aside from just doing their job, do better, make a difference. Don't just look at the balance sheet as your mission. Look at the ultimate objectives and goals that you serve that will influence that balance sheet. You can't make the balance sheet an objective. It's an outcome of other things we do. I never forget who I'm trying to influence. I'm trying to influence a system, sometimes very just and caring, sometimes unjust and oblivious, but I'm trying to influence a system to do better by the people it seeks to serve. And I never get tired of that.
I'm smiling because I expected you to give that exact answer to that question. And the reason is because I think that, and I hope that our listeners can appreciate this. It's really fascinating to watch kind of the stitch again when you're sitting in an outsider perspective. You can kind of see certain patterns. And so from that first story that you shared, how you were injured in your as a paratrooper, and you insisted on going back to battle, and pretty much everything that you've shared since, you have this incredible mix of complete selflessness, but also a complete commitment to that, where you don't back away. And I think so many of the things that you've said, even to this exact question, and that's why I asked it, like, and I assume, and I literally guessed that you were not going to say, yeah, I'm terrified out on stage, because it's not about you. And I think that everything that you do, even the way you present yourself in this conversation, it's not about you. And I think that's a tremendous lesson.
Well, that's very kind of you. Look, we go through different life pieces of our life journey, and certainly I've really been privileged to work with so many incredible people. Some who are with me at Fin Partners, which is really an incredible culture of people seeking to make a difference through their different disciplines, but others who have gone off in other organizations to do their own thing. And I realize to some extent that, because I'm transparent, I have to walk the walk. I have to talk the talk, yes, but that's easy. I've got to walk the walk. That's hard. And I'm constantly reassessing myself. at every stage of the day. And I never forget. I joke around that people say no one's watching. That's not true. Someone's watching. I know distinctly someone is watching. I won't get into the details of who is watching. You might guess, but someone is watching. And at every moment, I realize that my character, my integrity, my purpose, and my reason to be here is under a magnifying glass. And I feel that intensely, particularly this time of year. And I try to look at myself and course correct, self improve. So you're very gracious in your words. I am most certainly far from perfect. I know that. I know that. But I I don't think I'll ever be perfect. I know that too. So what I try to do is be in service of humanity, and I'm not selfless because that would mean I'm totally given up of self. I try to take care of myself, emotionally, spiritually, physically. I do all that, but I get incredible satisfaction in helping all sorts of people. Um, and I will share a little vignette. I know we draw close to our time together, but I was recently in Washington D.C. at Union Station. It's a changed Union Station um, at this stage than it was pre-pandemic. It was vibrant stores, shopping. Most of those stores are boarded up, sadly, and it has become also a respite for people who need safety. And I was with a colleague, and a man sat down to him and said he used to sing with this very famous black jazz singer, who I did know by chance. And he wanted to show me a video on his smartphone. I watched it. I said, "This is very impressive." I said, and he's telling us where he stays. He actually, the porters of Union Station have a crash pad nearby, and they let him crash there. Now,
Wow.
he's obviously not singing right now. He's not earning a living singing. He's in the train station. Very nice man. And I said to him, um, "Have you had anything to eat today?" He said, "No." This is like, I don't know, 3:30 in the afternoon. I said, "Hey, let's go grab a bite. Be my let's be my guest." And he looked at me when we got to this fast food place, which he ordered healthiest food. He looked at me and he said, "Well, what can I get?" I said, "Get whatever you want." And so the person I was with afterwards said, "How did you know?" Um, and I just said, "I opened my eyes and I opened my ears." And I think that's what we have to do in our profession. We're both health professionals, you and I. Probably those listening in our profession also. Let us never forget that we have to open up our hearts, our eyes, and our ears. And that will guide us to do the right thing. That will guide us to stay in the game. I hope everybody who's listening, who's joining your program today, recognizes they have a distinct role in impacting countless lives. And Mendel, you and your organization are doing an incredible job. Now, I hope that the health systems that tap into you realize how critical you are to their success, and most importantly, not just their economic success. When they've discharged someone from their system, um, they shouldn't hope and say, "I hope they don't bounce back in the first 30 days." They should really say, "I hope we've put in place through what we did and what our partners who do home health assistance and counseling do. I hope that they get them to a much better place, and if we see them on the street healthy." And I want to thank you for what you're doing, or your colleagues are doing, and certainly inviting me onto the program. It's a great privilege.
Well, Gil, the honor is definitely mine. You have a beautiful message, not just a necessary message, but a beautiful message. And I'm excited for people to see this and continue to follow Gil on LinkedIn. Is there a website?
I'm on LinkedIn, of course. I'm on X, formerly known as Twitter, at Gil_Bash. I invite people. I'm active on both those social platforms. I do invite you to connect with me and follow me on both. You can certainly visit medica.life, our editorial platform, www.medica.life. And I'm also actually on Medium. You can look me up on Medium. I have an active column there. And most certainly visit FinPartners, finpartners.com. Fin with two N's, a purpose-centered organization that, like you, Mendel, and many of our listeners, is trying to make a difference in this world.
Incredible. Gil, thank you so much.
My pleasure.